Hello, I'm Valeria, and welcome back to the channel. Today, we're breaking down norovirus, one of the most contagious stomach viruses in the world. It spreads fast, hits hard, and affects hundreds of millions of people every year. In the next few minutes, you'll learn how it spreads, what symptoms to watch for, and how to protect yourself and your family. What is norovirus and how easily does it spread? Norovirus is one of the most common causes of stomach illness worldwide. It leads to sudden vomiting and diarrhea, and affects about 684 million people every year across the globe. Norovirus is not just one virus. It is a group of around 50 related virus strains. What they all have in common is the same unpleasant result: frequent trips to the bathroom. Doctors describe norovirus as a type of infectious gastroenteritis. This means it causes inflammation in the stomach and intestines, leading to diarrhea and vomiting. The virus spreads all year, but it becomes more common during winter months. That's why it's often called the winter vomiting illness. In the Northern Hemisphere, cases usually rise between December and February. How does norovirus spread? Norovirus is extremely contagious. It usually spreads through tiny virus particles found in the vomit or stool of an infected person. These particles can get onto hands, food, drinks, or surfaces and then enter the mouth. This is known as the fecal-oral route. The virus can survive on hard surfaces, like door handles, bathroom taps, and countertops, for up to 2 weeks. Even a very small amount can make someone sick. Fewer than 20 virus particles are enough to cause infection. For comparison, COVID-19 usually requires exposure to hundreds of virus particles. When someone is actively sick, their body releases billions of virus particles in their stool. Norovirus can also spread through the air in some cases, especially when a person vomits or has diarrhea nearby. A person becomes contagious about 2 days before symptoms start, and they can continue spreading the virus for days or even weeks after they feel better. Places where people are close together, such as daycare centers, nursing homes, airports, and cruise ships, are especially high risk. Cruise ships are well known for outbreaks, and many have been reported in recent years. What are the symptoms of norovirus? Symptoms usually start suddenly. Common signs include stomach cramps, nausea, vomiting, watery diarrhea, chills or sweating fatigue, headache, mild fever. Most people start to feel better within 1 to 3 days, but the illness can feel intense while it lasts. Many people are too weak to go to work or do normal daily activities. When should you see a doctor? Most healthy adults recover at home without medical treatment. However, norovirus can be dangerous for certain groups: adults over 65 years old, children under 5 people with weak immune systems. In the United States alone, norovirus causes tens of thousands of hospitalizations and hundreds of deaths each year, mostly among older adults. The biggest risk is dehydration, especially from severe diarrhea and vomiting. If someone cannot keep fluids down, they may need IV fluids at a hospital. To stay hydrated, drink water or electrolyte drinks regularly. Take small sips often. Use ice chips or frozen pops if liquids are hard to keep down. Medicines for nausea may help, but do not take medicines that stop diarrhea, as they can slow down the body's effort to clear the virus. How can you protect yourself from norovirus? There is no vaccine for norovirus yet. The virus is hard to grow in labs, and it changes often, which makes vaccine development difficult. So prevention depends on basic hygiene. Wash your hands often. Use soap and water for at least 20 seconds, especially after using the bathroom and before eating or preparing food. Hand sanitizer is not enough. Alcohol-based sanitizers do not kill norovirus well. They can be used only as an extra step, not as a replacement for hand washing. Avoid contact with sick people. If someone in your home is infected, try to use a separate bathroom if possible and limit close contact. Clean surfaces properly. Use diluted bleach or hydrogen peroxide to disinfect areas where someone has vomited or had diarrhea. Wear disposable gloves while cleaning. Most regular disinfectant wipes do not kill norovirus. Look for bleach-based products and leave them on surfaces for a few minutes before wiping. Wash laundry carefully. Wash contaminated clothes or bedding separately using hot water and bleach if possible. Dry on high heat. Be cautious with shared food. Buffets, potlucks, and shared serving utensils increase the risk of infection, especially during peak season. Even after you recover, continue to be careful. Immunity to norovirus does not last long, and people can get infected again within months. Bottom line, norovirus spreads fast, survives on surfaces, and only needs a tiny amount to cause illness. Good hand washing, careful cleaning, and avoiding shared food during outbreaks are your best defenses. If you found this video helpful, please like and share it to spread awareness. Have you or someone you know experienced norovirus? Share your thoughts in the comments below. Subscribe for more clear, reliable health explainers. Thanks for watching. See you next time.